morning, good afternoon, everyone. This year again, we are here for the World Kidney Day 2024 and advancing equitable access to care and optimal medication practice is our theme. My name is Ifeoma Ulasi. I am from Nigeria. I'm a member of the International Society of Nephrology. I'm also a deputy chair of the Advocacy Working Committee of the ISN. So this morning, we have our presidents from the two foundations and society that have World Kidney Day as their initiative. We have our president, Professor Masaomi Nangaku, who is going to give us a welcome address.
Good morning, good afternoon for everyone around the world. I'm SF Lui from Hong Kong. I'm the past president of International Federation of Kidney Foundation, World Kidney Alliance. I'm also the co-program director of the Joint Steering Committee of World Kidney Day. Welcome, everyone. So maybe if you can introduce the president first then.
Professor Masaomi Nangaku is the president of ISN, the immediate past president of Asia Pacific Society of Nephrology, the president of Japanese Society of Nephrology, and also the president of Japanese Society of Internal Medicine. He's also a dean and a professor and the head of the Division of Nephrology and Endocrinology at the University of Tokyo Graduate School of Medicine. Professor Nangaku, you are welcome.
Yeah, okay. I also welcome Latha Kumaraswami, who is the president of the International Federation of Kidney Foundation from India as well. So we're going to introduce the two physician speakers and then two patient speakers as well. So
I'm happy to be introducing my dear friend, Dr. Valerie Luyckx. She's a nephrologist working at the Zurich Children's Hospital at Switzerland, and also holds an affiliate position at Harvard Medical School and the University of Cape Town. She is chair of the Advocacy Working Group, which means I work with her at the ISN Society, at the ISN, the International Society of Nephrology. Dr. Valerie, you are welcome.
Welcome. We welcome Dina Abdellatif as well. She is the consultant of internal medicine and nephrology at Cairo University in Egypt. Currently, Dina is the Secretary General of the International Federation of Kidney Foundation, World Kidney Alliance, as well as a member of the World Kidney Day's Joint Steering Committee.
As is natural with ISN, we involve our patients. So today we have two patients who are going to join in this webinar. I'm introducing Manvir Victor, a kidney disease patient who received transplant in 2012. Manvir is the WHO chairman for patient safety in Malaysia, a member of the National Patient Safety Council, and part of the British Medical Journal International Patient Panel, as well as a member of the Patient Liaison Advisory Group of the International Society of Nephrology. Victor, you're very welcome.
I will introduce my good friend, Bill Wang from Hong Kong. I will describe him as an expert patient because he had polycystic kidney disease and liver for 20 years. And I'm so pleased that he had a successful combined kidney and liver transplant 6 years ago. He retired from legal and governance professional by trade as a lawyer. He's an active in patient policy advocacy and organ donation program. Bill is a member of the ISN Patient Liaison Advisor Group Chair convener as well. So welcome, Bill. So we'll get the recording going. We'll come back after about 35 minutes for a discussion.
Hello, I am Masaomi Nangaku, the president of the International Society of Nephrology. I extend a warm welcome to all of you attending this webinar, which marks World Kidney Day 2024. Every year, World Kidney Day aims to raise awareness about kidney health among public health officials, general physicians, allied health professionals, individuals, and families. The campaign features a different theme every year, highlighting various aspects of kidney health. Today and throughout 2024, we focus on the theme of kidney health for all, advancing equitable access to care and optimal medication practice. This theme resonates with a powerful message, a call to ensure equitable access to treatment and care for those affected with kidney disease. Over the last 3 decades, efforts in chronic kidney disease treatment have primarily centered on preparing for and delivering kidney replacement therapies. However, recent therapeutic breakthroughs present unprecedented opportunities to prevent or delay the disease and mitigate complications such as cardiovascular disease. While these new therapies should be universally accessible to all patients in every country and environment, barriers such as lack of CKD awareness, insufficient knowledge or confidence in newer therapeutic strategies, shortage of kidney specialists, and treatment costs contribute to profound disparities in accessing treatments. This is particularly evident in low and middle-income countries, but also in some high-income countries. Now is the time to act and shift focus towards building capacity, increasing awareness, and ensuring equitable access to care. This requires a multi-level approach involving policymakers, healthcare professionals, non-governmental organizations, and patients. We are delighted that all of you can join us today. Throughout this webinar, you will hear from a diverse range of presentators, including kidney health professionals and individuals living with kidney disease. Now I'll pass on to my counterpart, Latha Kumaraswami, the president of the International Federation of Kidney Foundation, World Kidney Alliance, IFKF-WKA. Thank you.
On behalf of IFKF-WKA, the International Federation of Kidney Foundation's World Kidney Alliance, it gives me great pleasure to welcome all of you to the World Kidney Day 2024 webinar. Advancing equitable access to care and optimal medication practice is the theme for this year. And in this webinar, physicians and patients will share their perspectives on kidney disease and medications. The International Federation of Kidney Foundations World Kidney Alliance was founded by Professor Joel Koppel and like-minded people in 1999. We were renamed the IFKF-WKA in 2020. We foster collaboration worldwide to improve the health and well-being of kidney patients around the world. The IFKF promotes optimal treatment and care so as to maximize the health, quality of life, and longevity for people with or who are at high risk of developing kidney disease and kidney failure. We also want to create a global community and a network for people and organizations who are committed to improving the health and care of people who are at high risk of kidney disease. We want to be a global advocate. We want to partner with stakeholders, healthcare professionals, patients, patient caregivers, and like-minded people who want to promote kidney health and create awareness of this disease. The World Kidney Day is a joint initiative of the IFKF and the ISN, which was started in 2006, and it is aimed at raising awareness of the importance of our kidneys to our overall health and well-being, and to reduce the frequency and impact of kidney disease and its associated health problems worldwide. Every year we have a different theme, and we try to highlight certain aspects of kidney disease and kidney care. This year, we want to highlight medication, and we urge all of you to observe World Kidney Day, to make use of all the available material on the World Kidney Day website, so that you can make World Kidney Day a global activity. In fact, it can become a daily activity for all the foundations and everybody around the world. The ISN and the IFKF-WKA reiterate the importance of kidney health for all, and we rededicate ourselves to World Kidney Day. I also thank the President of the International Society of Nephrology, Ms. Nangaku, for introducing me and for joining hands with IFKF-WKA to make World Kidney Day a global day. Thank you.
World Kidney Day 2024 is all about kidney health for all, advancing equitable access to care and optimal medication practice. In 2019, 3.1 million people died of kidney dysfunction. That is one person every 6 seconds. And this makes kidney dysfunction the 7th leading global risk factor for death. In order to try to reduce these numbers, it's critical that kidney disease is diagnosed and treated early. How can kidney disease be prevented and treated? Risk must be identified early to provide the opportunity to treat early, appropriately, and consistently. In order to prevent chronic kidney disease, we need to understand what are the major risk factors. As shown in this analysis, the leading population attributable risk fractions for chronic kidney disease, which means the proportion of chronic kidney disease in the population that would be attributable to these risk factors, are high body mass index, high systolic blood pressure, and high fasting plasma glucose. As can be seen in all the different color bars, these are important risk factors in all regions of the globe, and therefore these must be tackled if we are ever to achieve kidney health for all. Looking at the first risk factor of hypertension, these data come from the Global Hypertension Report published by the WHO in 2023. As we can see, the bubbles in the middle depict the global burden of hypertension in 1990, and the bubbles on the right-hand side show the global burden in 2019. Each region is depicted in a bubble with a different color, and as we can see, the size of the bubbles in each region have increased between 1990 and 2019, showing that the global burden of hypertension is rising. In 2019, it is estimated that around 1.3 billion people around the world were living with hypertension, and this was defined as a blood pressure greater than 140/90 millimeters of mercury. Given the huge burden of hypertension and its crucial importance as a risk factor for chronic kidney disease, we need to evaluate the diagnostic and treatment coverage. These data also come from the World Hypertension Report, and as we can see that amongst both men and women, far from everybody who has hypertension is actually diagnosed. If we look at amongst those who are diagnosed who is treated, we see again that not everybody with a diagnosis is being treated. And very importantly, amongst those who are treated, only a fraction are actually treated to control, meaning a blood pressure below 140/90 millimeters of mercury. So taking together, these data show that around 21% of people with hypertension are actually on treatment and well controlled. This means that 4 out of 5 people living with hypertension around the world do not have their hypertension controlled, and the less that hypertension is controlled, the greater a risk factor it is for chronic kidney disease. Looking at the global burden of diabetes, as reported in 2021 by the Diabetes Atlas, we can see that around 537 million adults were living with diabetes. Concerningly, almost the same amount of people were actually living with impaired glucose tolerance, meaning not having an overt diagnosis of diabetes, but being at extremely high risk of diabetes. Importantly also, 3 of every 4 adults with diabetes live in low and middle income settings, which means that these individuals are less likely to have a diagnosis and are likely to have less access to quality care. Looking at diagnostic and treatment coverage for diabetes, we can see in the left-hand side that only around 61% of people with diabetes are actually diagnosed, meaning 2 out of 5 are undiagnosed. Amongst those who are being treated, only around 2/3 of these are actually treated to a hemoglobin A1C below 8%. Importantly as well, in people with diabetes, there are a large number of cardiovascular risk factors that need to be managed, and blood pressures may be elevated. Only around 1/3 of people with diabetes have blood pressures controlled to below 140/90 millimeters of mercury. And given the high cardiovascular risk factors, it's also important that people with diabetes have their lipids controlled. And as we can see here, only 14% of people with diabetes are on a statin. Diagnosis and treatment of diabetes and its comorbidities are therefore highly suboptimal. Coming to the global burden of overweight and obesity, the infographic on the left is taken from a World Bank report, and we can see that 2.6 billion people over age 5 were living with overweight or obesity, defined as a body mass index greater than or equal to 25 kilograms per meter squared. This accounted for 38% of the population, or 2 in every 5 people. Looking at obesity, defined as a body mass index greater than or equal to 30 kilograms per meter squared, this number reached almost 1 billion and accounted for 14% of the population. Importantly, as seen in the infographic, obesity is a major risk factor for mortality, but also very crucially, the prevalence of obesity is increasing rapidly everywhere. What does this mean for kidney health? So around 1 in 5 people with hypertension have chronic kidney disease, and 1 in 3 people with diabetes have chronic kidney disease. It's therefore critical that these 2 risk factors are diagnosed and treated early in order to try to reduce the risk of chronic kidney disease and to reduce the risk of progression in people who already have chronic kidney disease. Obesity also exacerbates risk in chronic kidney disease. This needs to be tackled through healthy lifestyles, as well as increasingly access to the newer medications which can assist with weight loss. Concerningly, 10 to 20% of people who are living with chronic kidney disease are aware of their diagnosis, and this means around 4 in 5 people with chronic kidney disease are unaware of their diagnosis. If people are unaware of their diagnosis, there's obviously no opportunity to treat and no opportunity to treat well, and this is therefore a major hindrance towards achieving kidney health for all. We have mentioned that diabetes is an important risk factor for cardiovascular disease, but it is important that people recognize that chronic kidney disease, even in the absence of diabetes, is a very strong risk factor for cardiovascular disease. And therefore, it is extremely important that in people with kidney disease, cardiovascular risk factors are well managed. And similarly, in people living with heart disease, attention needs to be paid to their kidneys. In order to truly achieve kidney health for all, we need to understand the distribution of the chronic kidney disease burden. As shown on the left-hand side, around 700 million people were living with chronic kidney disease in 2019, according to the Global Burden of Disease study, the majority of whom were residing in low and middle income settings. Acute kidney injury, similarly, occurs predominantly in low and middle income settings, and this is increasingly being recognized as an important risk factor for chronic kidney disease. So preventing acute kidney injury is also a key target. The chronic kidney disease prevalence is thought to be higher in low and middle income settings, although the data is not very robust. But importantly also, the age of onset of kidney failure is a lot earlier in people in low and middle income settings. It is therefore critical that health systems in low and middle income settings are strengthened to be able to diagnose and treat kidney disease as early as possible to reduce progression and prevent kidney failure. Screening for kidney disease is simple. It involves a urine test and a blood test, which are relatively cheap. In some cases may require an ultrasound, but in many settings where people have to pay out of pocket, screening might actually be too expensive. So what are the solutions, and how do we achieve kidney health for all? It is crucial if kidney disease is to be tackled that it is recognized as a national priority and that national strategies and policies are in place. As we can see here in data from the Global Kidney Health Atlas from the International Society of Nephrology, that in blue and green, even in high income settings, not all countries have these policies in place. Advocacy is required to raise awareness of the burden of kidney disease, the fact that kidney disease is eminently diagnosable and treatable, and that action is required to achieve kidney health for all. Crucial to achieving the goal of this World Kidney Day, Kidney Health for All, and advancing equitable access to care and optimal medication practice is the achievement of universal health coverage and strong primary healthcare systems around the world. Necessary to ensure affordable, acceptable, and equitable access to quality diagnostics and therapeutics for all. An important component of this is also to ensure that there are fair prices for these life-saving and kidney-saving medications everywhere.
Hi and happy World Kidney Day. In the coming few minutes, we will discuss the theme of the World Kidney Day for year 2024, advancing the equitable access to care and the optimal medication practice. Chronic kidney disease is becoming an extremely common problem with more than 800 million persons across the world suffering a degree of chronic kidney disease. Always, chronic kidney disease have other comorbidities, so this adds more to the problem, and the rank of chronic kidney disease as a cause of death is increasing every year and expected to be the 5th cause of death by the year 2040. So from now, we should prompt major efforts to develop preventative and therapeutic measures that are effective for this. And the aim of those measures should be to lower the incidence of the chronic kidney disease and slow its progression. Luckily enough, we have some medications now that we know and we have evidence that they have a renal protective benefit. Like, of course, the old RAS inhibitors, the SGLT2 inhibitors, the non-steroidal mineralocorticoid antagonists, and the GLP-1 receptor agonists. And through different mechanisms, those medications can help in delaying the progression of chronic kidney disease. And in order to get the best benefit of those medications, they have to be started as early as possible and in the early stages of the disease. And unfortunately, we have a problem with the awareness, and less than 20% of the patients are aware of their problem and aware that they have a kidney disease. And this shows the importance of the screening among the high-risk populations for the kidney disease. And eventually, a very few percentage of those patients are receiving the appropriate care and appropriate medications until late in the course of their disease. So in every situation, we always have to choose a right treatment or the right medication that would help in delaying the progression of the chronic kidney disease. And this is the KDIGO guidelines for the diabetes and chronic kidney disease. And looking at those guidelines, we find that the goal of treatment is not just lowering the blood glucose level, but treating multiple targets and also to use a protective and organ protective therapies, as we have mentioned before. So many medications would lower the blood glucose level, but we have to choose the ones that would give the patient an extra benefit for his kidneys and for his heart and for other organs. And also, we have to try to use as many as we can of the drugs that could delay the renal progression. And a theoretic extrapolation of the CREDENCE trial data would suggest that end-stage kidney disease in a typical trial participant may be delayed by 15 years, even when accounting for initial EGFR drip, if we use a RAS inhibitor associated with SGLT2 inhibitors. So we have to try to use and give the patients all the benefits of different medications as long as those medications are well tolerated by the patients. And it's not only about the initiation of the medication, but it's also about the continuity. And we need to sustain the drug across the stages of the kidney patients. Acute kidney injury can happen in some patients, and this should be treated and looked for the reason, and many reasons could be behind this acute kidney injury. And if it's corrected, then the patient would resume the medication. Also the same for the hyperkalemia, and which should be treated, and potassium binders could be used, which then help the patients to continue and to sustain their treatment with the RAS inhibition and other renoprotective drugs. And from previous experiences, we find that there is always a clinical or a therapeutic inertia, that despite we have the evidence and we have guidelines, but it is difficult to transform this knowledge into real practice. And there are many factors that's behind this clinical inertia that we will be discussing later. So we should find the reasons behind this therapeutic inertia and try to solve it. Some reasons could be because of the patients, some are related to the physicians, and some are related to the healthcare providers. And a few weeks ago, the World Kidney Day Joint Steering Committee just published the editorial about minding the gap in the kidney care, translating what we know into what we do. The editorial discusses the barriers to appropriate medication prescription and use in the chronic kidney disease, starting with the patient reasons and the polypharmacy and patients receiving many pills every day. And we should always look for the polypills and using one pill that have 3 or 4 medications at the same time, and this would save cost and would save pills and ensures adherence of the patients. Also the self-empowerment and giving them the knowledge and knowing more about their disease. The clinicians also have some issues. Some are burnt out, there are time issues, there are guideline overloads with guidelines coming out every day, lack of knowledge, and the patient complexity. The cost of the medications, and especially in the low income and the low middle income countries, and sometimes patients are paying out of the pocket for their medication. All this affects the adherence to the medications. The health system, there should be a multidisciplinary approach for the patients, and pharmacists should take more role in the prescription of the patients. They should revise the prescription, they could give notes for the clinicians and direct them or alert them that this patient is not receiving the appropriate drugs. Policy related with the lack of the early detection, as we have mentioned before, and there should be screening programs and identifying the chronic kidney disease as early as we can and be able to give them the medication as early as possible in the early stages of the disease to ensure delaying of the progression. And this is a global issue that has to be approached with many other issues. One can whistle a symphony, and there should be a multidisciplinary approach for our patients, and we also should listen to the patient's voice and listen to their complaint and discuss with them the reasons of the lack of adherence, discuss with them their disease, their medications, the importance of the medications that they are receiving. All this would help us overcome all the problems, the clinical inertia and the patient factors and all the healthcare provider factors. So I will stop here and thank you very much and looking forward to the discussion. Thank you.
Hello everyone. On this remarkable occasion of World Kidney Day 2024, as I sit here in Hong Kong sharing my reflections as a kidney patient, I'm humbled and inspired by the insights I have gained over the years from global healthcare providers and my fellow kidney patients who I've met in person or online. And this year's theme, Kidney Health for All, Advancing Equitable Access to Care and Optimal Medication Practice, resonates with me deeply. World Kidney Day holds a very special place in my heart, as it was during the World Kidney Day events exactly 6 years ago that I underwent a combined kidney and liver transplant to treat my polycystic kidney and liver disease. It also coincided with my 50th birthday 2 days earlier that year. I considered myself incredibly fortunate to have access to affordable and quality kidney care in Hong Kong. I would also like to extend my tribute to all the doctors and healthcare professionals attending this webinar. Your dedication to saving lives, improving kidney health, and advocating for more equitable and accessible healthcare systems deserve due recognition. Now let's dive into one of my favorite topics when it comes to healthcare delivery, patient-clinician communications. For that, I have adapted a famous saying into its new version. Doctors are from Mars, patients are from Venus. While it's true that both parties communicate, it often feels like we are speaking on very different wavelengths. Picture this. A patient walks into the doctor's office filled with questions, concerns, and a touch of anxiety. We seek answers, assurances, empathy, but often it feels like our concerns go unnoticed, fading away into thin air. Undoubtedly, doctors possess abundant medical knowledge and expertise. However, it is through clear, empathetic communications that they can truly connect with us patients, building trust and partnership. As patients, what we truly desire is an environment where we can freely express our worries, doubts, and fears without judgment or dismissal. We want to be heard and understood. That's why a communication bridge is so essential, a space where patients can comfortably share their concerns, doubts, and doctors can listen, empathize, coach, and inspire us to reach our full capacity and potential. And let's not forget about the language barriers, not the kind related to foreign words or phrases, but rather the medical jargon that seems like a foreign language to us. So please do let go of the complex terminologies and embrace plain language explanations. Break things down in a way that even average Joe on the street can understand. And why not add some visual aids like amusing infographics or funny cartoon characters? Laughter truly is the best medicine, is it not? Light-hearted talks aside, effective communications in healthcare is more around our safety and peace of mind in medication space. We patients worry about the potential side effects of the drugs we take and how they might impact our daily lives. So please address these concerns with generosity of your time. Coach us on what, when, and why, and how to take medication. Provide information on possible adverse effects and interactions. Explain their likelihood and offer practical strategies to manage them. By openly discuss our worries, you can enlighten us, calm our anxieties, and help us build trust in your treatment plans. Now, let's touch upon another critical aspect of communication, the seamless work among healthcare workers and its importance on our drug regimens. Collaboration and coordinations among clinicians of different specialties are crucial for our kidney health and kidney care. where kidney patients often have multiple coexisting conditions, requiring you to put together multiple expert teams. When you doctors communicate effectively with your fellow healthcare professionals, we take comfort that our treatment plans are personalized, avoiding excessive polypharmacy and mitigating the risks of adverse effects and interactions. Seeing your coordinated moves is like witnessing an elegant dance routine, synchronized, graceful, and inspiring. It's artistic work with science at its core. Wow, is that amazing? Now, let me conclude my remarks by appealing to you to embrace effective communication through bridging the gaps, overcoming language and culture barriers, and adopting a patient-centered approach that promotes open dialogue, cultural sensitivity, shared decision-making, and team spirit. Thank you so much for your attention. May this World Kidney Day inspire us all to work together towards a future of optimal medication practice and equitable kidney care for all.
Hi, good evening, wherever you are. My name is Manvir Victor. I am a patient advocate trained by the WHO. I have been in this space for the past 13 years, officially, of course. Unofficially, while I was on dialysis, I was a patient, of course. So that journey has been about 24 years to date. And today I'm here to share with you about drug literacy, polypharmacy, and compliance from right here in Malaysia. So I just want to share a few things, which is very key, important facts for us to realize, of course, before we really get into the hard data on it. First, of course, there is 65.1 million health workers in the world, as according to the WHO's National Health Workforce account. Now, in 2020, very interestingly, the global workforce was 29.1 million nurses, 12.7 million medical doctors, 3.7 million pharmacists, 2.5 million dentists, 2.2 million midwives, and 14.9 million additional occupations, tallying to a total of 65.1 million health workers. Now, we need to juxtapose that against the fact that the current world population for 2024 is 8.1 billion, which is a 0.91 increase from 2023. Now, the population of the world in 2023 was 8.05 billion, which was a 0.88% increase from 2022. So you can see the trend lines there, right? Now, unfortunately for us and the rest of us here in healthcare, we find that the only 0.8 of total world population, and I'm looking at the healthcare professional, that says treat the entire world. So if you can see already, it's only 0.8%, but the increases year on year are 0.88 and 0.91. So how does healthcare keep up with these increases and still deliver better outcomes? That is a huge issue. But once we look at it from a data point of view, we know that obviously it's huge. It's a huge issue, right? It's 0.8 of the world population taking care of, well, 99.2%. If you're not taking care of other healthcare, right? So how do we sort this out? A possible solution, of course, is to engage, educate, and empower the person, which is families, patients, caregivers, to assist healthcare to deliver that outcomes that we all need. Now, with drug literacy, polypharmacy, and compliance, obviously, they need clear instruction, constant monitoring, feedback on possible side effects with regular updates. Now, this is to allay confusion due to newer non-medications available, quick and consistent updates available to ensure that outcomes are not compromised. That's key, of course. Medical jargon needs to be explained in layman terms for public consumption. Localization is very key where necessary to relate to conditions in that space, in that country. Obviously, we continuously need to develop targets and outcomes with updates periodically. This needs to be done. We have to decide whether that's happening every 3 months, 6 months. There are great innovations happening that help healthcare and can obviously confuse the patients. Research and development into guidelines needs to be constantly done. Now, possible solution, of course, in person-centered healthcare, health and social care professionals work collaboratively with people who use these services. Person-centered care supports people to develop the knowledge, skills, and confidence they need to more effectively manage and make informed decisions about their own health and their healthcare. Now, persons' engagement can happen through clinics, organizations, online conferences. That's engagement. Education happens through training modules which are available. Non-clinical dissemination by successfully certificated persons, by you guys, of course. Digital availability of information and data managed by non-clinical people to develop and monitor outcomes for sharing. And obviously, successful replication of this within participation facilities and nations. So this is a possible solution. Engage. Of course, educate and empower your patients to be able to do this. This is all key in helping solutions to make sure that drug literacy, polypharmacy, and compliance happens at a better rate. Now, whatever that we have been doing in the past 3 to 5 years looks a little dated, obviously, with the latest innovations coming in digital sphere, which is AI, which everyone is struggling to comprehend. And I don't blame doctors and healthcare professionals for struggling with this, but it is also important that patients, which are people, persons who have this speciality in that area, to be able to help out there. So thank you very much. My time is up, but I'll be available after this for some questions and answers. Thank you very much.
We welcome everyone back here for Q&A sessions. We are aware of the quality of the video may not be as good as we wish it was. We apologize for that. Maybe if you want, we'll get the discussion going. I think it's so unique that we got professionals, healthcare professionals, and patients on the same platform. That's the whole purpose of this, to facilitate a dialogue between the both parties, so that you can each understand each other better, how we can actually move forward. Maybe we could welcome the President and to make a short comment first, if that's okay.
Yes, thank you. It is great to have this webinar on the day of the World Kidney Day, and I especially thank our patient representatives to join this webinar because the voices by the patients are the most important thing for us. And I'm very happy to hear the 2 excellent talks by the experts. They gave us a lot of insights about the kidney care and kidney health from the global point of view. I also want your comment as well.
Latha, we'd like to say a few words and we'll get the Q&A going.
Sure.
Yes, I think that this has been a very, very interesting one hour. Hearing the patient's perspective, Bill and Manvir really brought out all the problems. I'm not a doctor, so I understand from a patient's perspective because I was a caregiver for my mother-in-law. So I know all these questions, the jargons that I'm so sorry that the doctors use. And I think that we would really learn a lot from this webinar, that, you know, there's a lot of patience. Patients have to be dealt with, a lot of patience and a lot of understanding and care. And yes, the global burden, you know, is increasing. And definitely, the question that was asked by someone was that, what is the research being done? Will there be an artificial implantable kidney soon? Research is being done. I know personally there's a Dr. Shubho Roy in California who's doing it. It's a long haul, and we're hoping that at some stage it will become a reality. Thank you. Thank you all. It's a wonderful webinar so far. Thank you.
I join SF and all the others in welcoming all of us to this second session of the webinar today. This is the Q&A session, and we're going to take questions from patients and try to answer them. Some questions have been posted in the Q&A, so we'll take them one at a time. One of the questions Latha had answered, but maybe we want our president of ISN, Professor Nangaku, to speak a little bit more about artificial kidneys.
Thank you very much, Ifeoma. The kidney is a highly complex organ, and an ideal artificial kidney should be wearable or implantable and should be able to perform filtration, reabsorption, endocrine, and metabolic functions of the kidney while preserving the quality of life and minimizing complications. And there are groups working actively and hard. The progress is slow but steady. The future is bright.
Yeah.
Thank you very much.
Maybe we can invite Dina and Valerie to respond to what you hear about the patient's voice. I know everyone is so busy in the clinic, it's really troublesome to find time, and how can we address the concern? And then we can actually maybe get the two patients to share with us what you understand. They also need to understand the problem from outside the healthcare professional side. We really try to do our best, but it's not easy. Maybe Dina and Valerie to make a short comment first and to respond to what you hear from them.
I can begin. I thought the two patient interventions were fantastic. Honestly, personally, my feeling is very often, given that chronic kidney disease is really a journey, it is a long process. I feel that it is our kind of obligation and our job, and that's a large part of what I enjoy about being a nephrologist, is really being the companion of the patient along this journey. I think continuity of care for me is a critical issue because people need to get to know each other. You know, it's a little bit almost like family members eventually. When you really know somebody over a very long period of time, one has to understand who they are, how the disease is impacting their life, how they can, you know, look after themselves as best as possible. Because any patient with a chronic illness is really their best doctor and their best nurse. They are the ones who know. So I do feel it's our obligation to make sure we explain intelligibly, but really to be this companion. And I feel we have to. Sorry, there's an echo. I feel we need to really be a companion for the patient on this process, sharing our knowledge, encouraging, going through the ups and downs, because there are ups and downs, unfortunately, with kidney disease. But again, also sometimes we have to fight a lot to fill in forms, to get access to medications, etc. But I think there's then a great satisfaction when we finally, you know, find the right recipe for the right patient, who then hopefully can stabilize and live a good quality life. Thank you.
Yeah, it's a lifelong relationship, isn't it? It's a partnership, education them and empower them as well. How about Dina? We'd like to have a few quick words on your.
Well, I find the two presentations really very, very engaging and encouraging, and it's very important to always make this conversation between the doctors and between the patients. We are too much concentrating and concerned about the medications and about the labs and the tests and everything, and at the end, the patients are concerned about their well-being, about their lifestyle, about their work, about their families. So this kind of conversation, it's really very important. And many times we are prescribing a huge number of pills for the patients. This is for your diabetes, this is for your heart, this is for your kidney. And at the end, the patient cannot cope with all this. Sometimes, Sometimes patients, they are paying for those medications out of the pocket. They cannot buy the medications. They are sometimes embarrassed even to say that they cannot get this medicine or they cannot. But we have to be close to them, and we have to understand the barriers and understand the number of the pills that they are receiving every day, which is sometimes huge. We have to modify the prescription. We have to use polypills and put many medications in one pill. So it's very, very important to get in touch and listen to them. And whenever we go for public awareness sessions, we really learn and we really understand from the patients, and we understand what do they need and how we talk to them. In clinics, we are all talking to the patients about their tests, about their labs, and you find the patient in the end asking you about the simple questions, about what to eat, about how to cope with all this number of the medicine. They are focusing about their lifestyle and about their daily practice rather than the numbers that we are sometimes concerned with. Thank you.
Thank you very much, Dina. For Victor and Bill, we heard you loud and clear that we need to talk to our patients. We need to communicate. We need to kind of be partners with our patients. We don't need to be paternalistic in dealing with them. We need to understand that it is a multidisciplinary team. Everybody sharing one bit of the other because of the complications and all the sort of things that occur. And Victor, you talked about education, empowering you to know how to go about your disease. And like we know, and Valerie said, it's a lifelong thing. So we are here to partner with you. I think that's what we should get to teach most of our younger doctors. Before I hand over to my colleague, there's a question on the Q&A chat box, and it comes from Mirel Tapia. And it says, what are the main barriers that chronic kidney disease patients encounter when it comes to participating in clinical trials? I think we need to look at that, because before now, we did not have a lot of clinical trials in the area of this space, of kidney disease, yes. But thank God we are having a lot more. So who would want to jump in?
Do I
start with?
Maybe I can.
Yes. Okay, I would like my president once again to start off.
Can I comment?
Please.
This is Masaomi.
Please.
That's a very important question, and that's a very interesting question, because we, from the side of doctors, we are always looking for patients to participate in a clinical trial. So this question was a little bit surprising to me. This may depend on the disease which one suffers from, or it may depend on the region where you live. In some regions, there are many clinical trials running, and if the one is suffering from a common kidney disease, it should not be difficult to participate in the clinical trial. If it is a rare disease, or if one lives in a region where clinical trials are not running often, it may be difficult to participate. I want to have Valerie's comments on this.
Thank you, Masaomi. I think there's a challenge sometimes in terms of equity. I think what we saw from the SGLT2 trials, inhibitor trials, for example, none happened in Africa. Very, very few Black or African origin patients were included. So I do think that there are certain barriers that certain populations are not asked, are not included, or they somehow don't fit eligibility criteria. So I totally agree with you that we need to engage patients. It's critical, though, that we do have the spectrum. There, obviously, Ifeoma can speak more, but I wonder Bill and Victor probably have a lot to say as well, potentially having been approached and maybe what they decided to do about participation, yes or no.
I just want to pitch in a little bit. Sorry. Okay, Bill, can you go on?
Sure. As a matter of fact, as PLAG, the Patient Liaison Advisory Group, we actually participate the clinical trial focus group. This is another group in the ISN. Now, my feeling is, it's like you see the, it's like semen on the sea. They see waters everywhere, but the water is not drinkable. So you are try very hard, doctors, trying to find subjects to study, and we patients want to join a bandwagon, but have find no way to participate. So there should be a bridge. There should be a mechanism to bridge these two, so that the eligible patient will be able to join these very meaningful, very impactful clinical trials. I know doctors try very, very hard to find subject patients. We even do, for example, the summary of clinical trials, translating into a very sort of plain English language type of summary, to hopefully that entice the patient's interest into clinical trials. So there should be a communication, there should be a bridging from the patient side and the doctor's side. And we'll be very happy to bring these two groups together, and so that, to help your scientific work.
Sorry.
Thank you very much. Latha, you seem to want to make a comment. Latha.
So I just wanted to say that, everyone's enthusiastic about the trials. I mean, I run a kidney foundation with 900 patients. There is a lot of suspicion also about trials. So I think we need to be very, very clear to people when they get onto trials. Second thing is very difficult to comply to what is required for the trial. The patient compliance, and a lot of dropouts, because a lot of the trials are difficult, to follow. Whatever the medication, the timing, and everything that's got to be taken. So we have to keep all this in mind as far as the trials are concerned. What is the challenge for the patient? Thank you.
Manvir, speak.
Yeah, I just wanted to add that I totally agree with what Bill was saying as well, and Latha. It's quite difficult. I mean, in certain cultures, in certain places, clinical trial means guinea pig. So it's quite easy for a doctor to ask a whole group of patients to undergo this. But when a patient himself starts to reach out to other patients, because they journey to this together, you may have more participants. I'm not saying it's going to work 100%, but that, because I understand what other patients go through. Maybe the doctors don't have first-hand knowledge of this. We do as patients. So I know that in Malaysia, when you say clinical trials, doctors asking me to go for clinical trials, some patients have come up to me and say, I don't want to be a guinea pig. I don't want to be a guinea pig. So it's very unfair for them to say it, but that's what is happening today. So maybe having a patient to speak on your behalf as well, and then, to take that journey with these patients may help a little bit with compliance.
Maybe we bring Valerie back in again. The issues of big international trial, I think, to ensure that it's done correctly, quite often there's a lot of patient selection and exclusion. And in fact, high-risk patients usually excluded but it's unfortunate. Maybe Valerie can comment on that. How can we actually touch on those with the latest stage of disease?
Well, I think that's very difficult. I think especially when we think in chronic kidney disease and heart disease and heart failure, we know that more people are dying of heart failure than kidney failure, and patients with advanced kidney disease who are the highest risk are excluded from all the studies. So that's a big problem, and that's changing slowly. I think part of that's due to the fact they don't want complications, and we don't always know the doses. But one thing I did want to just respond a little bit to the guinea pig comment. First of all, I think people need to understand that studies always are reviewed by ethics committees and things beforehand. So in general, one is trying to be as safe as possible. Sometimes the informed consent is 5 pages just because of this transparency. But one extremely interesting scientific fact, and maybe Masaomi and Ifeoma can comment, is that very often, even if it's a randomized trial, meaning people by chance are either on the active new drug or the old treatment, the patients in the placebo group generally do better than expected. So just somehow participating in a clinical trial seems to have a benefit even if you're in the placebo group, especially in diseases where we don't have options. It's generally suggested. So in the cancer world, they suggest really to patients, go and enter a trial. We don't have a good option, just try. And that has brought the cancer world very far forward. So I think we need to remind ourselves that these trials are being done under ethics guidance. There are also usually data safety monitoring boards that are checking every couple of months. I don't want to keep going. I think Masaomi can talk, but I feel, it is a safe-ish, and it should be, shall we say. There are obviously exceptions, but it should be a safe environment.
Okay, Mr. President.
Yes, thank you, Valerie. You made a very important point. As you pointed out, the previous studies showed that those who are assigned to placebo do better, as you pointed out. And probably that's the issue of the insurance provided by the government. The insurance usually allows us to do only some limited examinations or things at the routine clinical practice. Well, if one participates at a clinical trial, it is out of the insurance, and we usually do many examinations, which probably allows patients to get more enough assessments of the disease status. That can be the reason for the better status who are assigned to the placebo group. That's a very important point. You're muted.
Dina, quick comment.
I just wanted to pitch in the clinical trials talk. First of all, if there's a standard of care that is used against the active ingredients, if there's no standard of care, that is when you can use a placebo. And indeed, as Valerie said, if you use a placebo in some patients, they actually do better than is expected. One reason is because they are being looked after, everybody, you're being checked, and then your compliance improves, you're happier. And when you're happy, your well-being improves. So there's a lot of things they talk about this. So yeah, I would suggest to our patients to indeed, if you are able to participate in a trial, please take on it, because first of all, we'll be able to develop the drugs that can help you. Like in Africa, Ghana and Nigeria, we're about starting the APOL1 mediated kidney disease trial, one of the molecules. I think there are several molecules developed. And I'm encouraging, because I'm sure African patients are listening, I'm encouraging you to put yourself forward to be recruited. Doctors will check if you fall into the inclusion criteria, or if you don't fall in, if you're going to be excluded. Nobody is going to put you in a trial that will hurt you. So that's my plea to all our patients. Thank you.
I'm mindful of the time. It's just gone past 7 o'clock. Yeah. May I invite all the speakers here to prepare a 20 seconds closing remark or a question you can ask. But while they're thinking about that, can I just raise a final question? We talk about equity. In fact, drug expenditure is big. A lot of places probably spend 10%, 15%, or even higher of the total expenditure on medication. Is a phenomenal amount of money. But how do we appropriately use that money sensitively? That's a question about how about the rare disease that's so expensive now? Or do we focus on them? Do we have them? Or do we just focus on the the broader thing for everyone that's matter. Maybe once again, I would like to hear the president say about that. It's about health policy. How do we make good use of money?
That's the very important question, which I cannot cover within 20 seconds. But we have to use money wisely, and if we can delay the progression of the disease or even halt the progression of the disease, that costs even much more than we waste or we use. So that's my answer.
A lot of waste. So saving 15 years of dialysis, a lot of money to buy drugs.
Right.
Yeah. So in view of time, may I invite the two physicians to make a final comment, your comment that they would like to relay a dialogue to the patients and then the two patients as well. Dina, would like to your final comment to the patients?
I'd just like to say something here. Sorry, Asif. I'd just like to say that in India, the government is offering insurance policies. They're giving a lot of help so that we can decrease the inequities for patients. They're also going all out to create awareness. So I think advocacy is the answer, and creating awareness is the answer at the end of the day. Thank you.
We're getting back to a theme of the World Kidney Day. That's good. Okay, I really am watching the time. Maybe 20, 30 seconds from each of you as a final comment.
Well, I continue from what Latha was saying, but at first we have to increase the awareness. We have to advocate for the awareness for the kidney disease, for the prevention, and this is the first issue, and this is the first point for even for all the money that is spent on the medication and everything. So number one, it's the awareness and the prevention of the chronic kidney disease and the early detection of the risk factors for the diabetes, for the hypertension, for the heart disease, and for the kidney disease. This is the main issue. And then we have to make a conversation with patients and conversation with the policymakers and the healthcare providers to make sure that we provide our patients with the best and optimum medication that we can do. Thank you.
Valerie?
Thank you. I think just two quick messages. The one is I think kidney care needs to be integrated with other non-communicable disease care, since there's this huge overlap between kidney disease and all others, which should simplify delivery of care and should improve quality of care. And the other thing is we need to engage with the pharmaceutical industry to make the medication affordable.
Okay.
Thank
you. Your final comment, or Manvir? Either one of you first.
Sure. Dr. Lui, you asked me earlier a question, what's my ideal doctor is. I mean, just linking to this theme of World Kidney Day, I want my doctor to be a polypill, be a scientist, being a clinician, being an artist, being a social worker, being a nutritionist. You're a combination of, because I'm serious, because you are the first point of contact of any patient. Even though you can claim that I do not have certain expertise in X, Y, Z, but your patients really expect you to at least direct the traffic correctly and doing a primary assessment and being empathetic and being passionate about the patient as a whole person rather than a patient with a specific disease. I think that's on my wish list. But having said that, the Hong Kong doctors are doing very, very well. I mean, I have no complaints about the doctors I encountered in my clinical settings.
All doctors really try their best to do for a patient, trying to be good and compassionate as well. Manvir, a final comment from you, and then we'll ask the two presidents as well.
Yes, thank you very much again for having me on this. Just want to reiterate that to engage, to educate, and empower the patients to help you take care of themselves. I may spend 15 minutes or half an hour in a day talking to my healthcare professional, but the rest of the day I'm on my own. So if you can educate me better, I'm more empowered to do that. That is the way forward, to integrate the patient into it. And I, for one, want to put my hand up and say thank you very much to all of you all for engaging with us. My name is Manvir, and as is my name, that's my social media handles. Please try to locate us, locate me. Let's make this patient engagement a part and parcel of healthcare. Thank you.
A final comment from the two presidents, please.
Thank you. First, I want to thank the chairpersons for running this session so smartly and so beautifully. This session was so fruitful, and I learned a lot. And I also want to thank the speakers and the patient representatives for joining us today. You made this session such a wonderful one. And last but not least, I want to thank IFKF and ISN for having this opportunity. Thank you.
Latha?
I thank ISN and IFKF-WKA and all the people on the panel, Dina and Bill and Ifeoma and Manvir and Valerie, and of course the ISN team for taking this forward every year. It's a wonderful idea, and I'm sure that a lot of people are benefiting from it. Kidney disease is a long-term disease. Whether you've had a transplant or whether you've just, whether you're on dialysis, it is a long-term disease. So we really need to keep at it constantly, constant care, constant awareness, and constant early detection. These things I reiterate again. Thank you so much.
I'll use my 30 seconds before I allow Ifeoma to close this section. I really hope that we don't need to wait for another World Kidney Day to have a platform like that. I hope ISN and IFKF may continue to explore webinar like this when we can bring both parties together to have a very frank conversation. My closing remark is to the healthcare professionals. Think about the 5 rights. Find the right patient, treat the right patient at the right time, with the right drugs at the right dose to reach the right target. I think those are the aims that we want. To the patients, my message to them is try to understand a bit more about your drugs, what they are for, why you need to take it. It's all part of what we talked about a few years ago. This is health literacy. It's both parties. It's us telling you what you need to know and you trying to find out what this is. So I wish everyone good. Ifeoma, your last 30 seconds in your closing remark. Thank you very much for being a good partner for both of us as collaborator for the moderator.
Thank you very much, everyone. Our panelists, thank you very much for bringing so much to bear in this webinar. I just want to correct a little mistake. The placebo I meant was dummy placebo and then controlled drugs. So I pray that you have learned a lot and that you're going to, our patients, you're going to comply or adhere to your medications. And then if you have problems, you can always meet your doctor. And for the doctors, I talk about the 3 E's, as Victor said: engage, educate, empower. And then listen, as Bill said, listen to your patients. They wear the shoes, they know where it pays. Thank you very much, everyone, for participating.
Okay, thank you very much. Wish everyone well. Thank you. We're repeating the webinar again at 12 hours later. That is 11 p.m. CET time. That's the morning for American and Australia as well. Okay, right. Nice to meet all of you. Thank you very much. Good evening, everyone, or good day, or good morning.
Bye.
Bye.
Thank you.
Bye.
Bye-bye. Thank you.
Bye.